pavement, hoping it'll cave in and swallow me whole. Wonder why my mind keeps on spinning. This isn't how living to me was told. Why am I like this? Something's always amiss. Can't put my finger on it, but it's there. Wait for it to subside, but my mind won't apply. Waiting for the clear. Is it bad sometimes? I like it when I lose control. There's something in it that's so beautiful. Listen, I can see the light today, but I can also see the bones decay. I don't know what else there is to say. I'm doing my best not to run away. Sitting throwing rocks across the pavement, hoping it'll cave in and swallow me whole. Wondering how the world keeps on spinning, kinda scared of living when it unfolds. Hard to see the light when everything is dying, waiting for the clear. Thankful I'm alive, but terrified of dying. But hey, I'm still here. Is it bad sometimes? I like it when I lose control. There's something in it that's so beautiful. Listen, I can see the light today, but I can also see the bones decay. I don't know what else there is to say. I'm doing my best not to run away.
You're the night sky, trying to make me see your stars. But the dark gets so lonely. Now I see violet, I can feel silence. And the dark's all that I see. When your stars have burnt out and your heart makes no sound, I'll find violet in your eyes. You'll always be my night sky. You'll always be my night sky. You're the night sky, hiding behind dark gray clouds. I can't figure you out now. I see your blue. There is so much cold in you, and the silence is so loud when you go. I just stay dancing with my shadow all day. Watch the time. I can't find the point where to pass the line, right? You're the night sky, I'm trying to see your stars. your heart makes no sound. I'll find violet in your eyes. You'll always be my night sky. You'll always be my night sky. You'll always be my night sky. You'll always be my night sky.
I get lost inside my thoughts, and when I start to think, oh, the hold closest starts to end up on the brink. I tried so hard, but all these scars, they cut so deep, I bleed. I fell so fast from heaven, it's like someone clipped my wings. Now I'm falling, and I can't see the ground. Can we stop this gravity? It keeps bringing me down. I can't breathe, and I don't wanna die. Can we stop this gravity? 'Cause I don't wanna say goodbye. Just begging to let go. I almost got to suicidal thoughts, but you stepped in. An angel sent from heaven showed me how to live again. Now I'm falling, and I can't see the ground. Can we stop this gravity? It keeps bringing me down. I can't breathe, and I don't wanna die. Can we stop this gravity? 'Cause I don't wanna say goodbye.
that I'd never say goodbye or ever leave this stuff behind. When it's good, it's amazing. When it's bad, it's uneasy. I wouldn't have it another way. There's no other way. Yeah. When it hurts like this, have a like, beat it, have a like, have a like, have a like, have a like, beat it, have a like. When it hurts like this, have a like, 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 when it hurts like this. And I've been chillin', watching the ocean with you. Baby up with a slow motion crew. And we up in our cloudlands when people change, but not us. And we just chillin', kicking it, kissed by the sun. Could be soaked to the skin in the mall soon. I know she got the good vibes when seasons change, but we're the same. Even if I lost all my money, the zero runs deep, honey. And I don't need to speak a single word, 'cause you got me holding, holding. Even if my jokes aren't funny, my tongue tied up on it. And I don't need to speak a single word, 'cause you got me holding, holding. 'Cause you got me holding, holding. Cause you got me holding. And I'll be running, possessed by a low, low voodoo. Fired up like a wolf on a full moon. And we're stuck in a la la land. The tides will turn without us. And I'll be killing time like I might be a cartoon. Take it in real life like haiku. I know we got the good vibes when pieces fall right into place. Even if I lost all my money, the zero runs deep, honey. And I don't need to speak a single word, 'cause you got me holding, holding. Even if my jokes aren't funny, my tongue tied up on it. And I don't need to speak a single word, 'cause you got me holding, holding. 'Cause you got me holding, holding. Cause you got me holding. Play me like a bass guitar. Simmer down and mess me up. Tripping like I'm Jimmy at Woodstock. Drive me around in your red Ford. Shivers down my spinal cord. Cause you got me holding, holding. Even if I lost all my money, the zero runs deep, honey. And I don't need to speak a single word, 'cause you got me holding, holding. Even if my jokes aren't funny, my tongue tied up on it. And I don't need to speak a single word, 'cause you got me holding, holding.
All right, everyone. Okay, let us begin. We've waited here a little while, so let us see if we can get started here, and hopefully others will join us soon, and that they won't have a difficult time. I just want to, before we get started, just to confirm that everyone is hearing me okay. Is everyone hearing me okay? If the volume is too loud or too low, please let me know. All right, so just waiting for that confirmation to come in. All right, perfect. All right, so I'll take Kimoya's word for it, and assume that it's the same for everyone else. Good. So let me just get rid of the background music here, and we can get started right away. All right. So the topic for today is the 7 keys to getting and staying well. And I hope that the information that we share tonight will be enriching, to say the least. Yeah? Now, as we go through tonight, I want you to basically keep in mind that we we don't know everything there is to know about health or healthcare as a people, but if we share information with each other, we'll be able to better, appreciate the nuances around it and also make better decisions. Because if we keep information to ourselves, we don't grow. And one of the things I've learned over the years is the more you teach, is the more you learn. So that's why I've looked forward to getting the opportunity to teach as much as possible, so that those who hear this information can impart their own contribution. And as we bounce things off each other, that's how we grow, that's how we learn. But the primary objective for us for this um, course or for this lecture is so that you will learn something that you can take away from here, apply it to your day to day lives, and so enrich your own lives and the lives of your loved ones and those who you have control over. So, for me, it's an important thing that we get to share like this, and I hope you find it enriching yourselves. So, let us begin here. So the topic is the 7 keys to getting and staying well, and I hope that you will enjoy it. And please be sure to participate. I mean that you have the access to the chat, so I'm gonna encourage you to just go ahead and to put your little suggestions in the chat section so that you can make your suggestions, make your input. If you have a question, if there's something you don't understand, if there's something you want me to repeat, feel free to just go ahead and post it in the chat. And hopefully, by the time I see it, it would not have passed for too long. All right? So, let us begin. So, as we look at the 7 keys to getting and staying well, the first key is a very important key in the whole thing, because what I've come to realize is that if you do not have an appreciation for critical um, terms or a critical appreciation for things, then what can end up happening is that you are either easily led astray or misled, or you can have a wrong um, viewpoint just because of your starting point. And so what I try to do is to make sure that we're on the same page when we start so that you can understand where we are. All right? So let me try to make this a little bit all right, wider. So to do that, I chose to start with an appreciation of what we call the healthcare system and what it really is and what it is not. Because the name healthcare system is kind of misleading. Most persons, when they hear healthcare, they assume it is a system that is focused on getting sick people well. That is not the goal of the healthcare system. It might be the goal of individual doctors, but the system is not geared at getting you well. It's geared at easing suffering and saving lives. That's what it's geared toward. That's the focus of the system. And so, if you understand that, then you'll have a better chance of understanding why the decisions that are made are made. So, when we look at it and look into it, what I've come to, you know, I always ask is why would they make a decision like in cancer treatments? Why would they give you something like chemotherapy, which they know is a poison, and there's no way that giving somebody a poison can get them closer to health? Why would they make that choice? Well, the choice is easy to be made if you understand what their focus is. Their goal is not to get you healthy, their goal is to save your life. And in their estimation, if you have cancer and the cancer could kill you, then the more immediate threat is the cancer, not the chemotherapy. And so they give you this poison with the hope that it will destroy the cancer so that you can now, after the chemotherapy has stopped, regain your health. But the treatment itself is not geared at getting you healthy. I don't know if that makes sense. All right, it's trying to stop the disease process from continuing. And so this is what the healthcare system is about. Who is a primary person that the healthcare system is targeting? And feel free to answer away as you write in the chat. But the primary person is not the healthy person. The primary person that the system is geared toward is the sick person. This is trying to help those who are already ailing with something. And so if you understand that, then it will make sense. So you'll see when I say this system is more of a sick care system than a health care system, then you kind of understand what I'm saying. I'm certainly by no means trying to be derogatory in my descriptions, right? So when we look at it, the sick care system is what it is. It cares for the sick person. But by virtue of that, you have to have a sick person. And in order for you to have a sick person, you have to wait until illness has taken seat, which means that this system is at best a reactive system. What do I mean by reactive? Who can share what do you think I mean by reactive? That this is a reactive system. Let me just give you a second for those who might want to comment in the chat. Well, this system is a reactive system because we wait until something has gone wrong first. That's what it means by being reactive. You wait until something has gone wrong and then you try to act thereafter. But that is not necessarily the best thing. And there are many reasons for that to not be the best thing. One of the reasons is that if you wait until something goes wrong before you act, the very thing that goes wrong could be something that you cannot fix. Or the very thing that goes wrong could be something that kills you or claims your life, and so you don't even have the opportunity to try to resolve something. And so, as Blossom says, it creates a response to the situation. That's what we do. That's what it means by being reactive. There is a situation, we wait for the situation to occur, and then we create a response to that situation. Now, the alternative to sick care is what we call true health care. And in true health care, as opposed to the system that we have that we call the healthcare system, in true healthcare, we don't have the luxury of waiting for things to go wrong first. We don't want to wait for things to go wrong. In true healthcare, if we want to achieve that, in true healthcare, the goal is different. The goal for true healthcare is optimizing health and vitality. That's what true healthcare is about. So if you want to optimize health, you can't wait for something to go wrong, because what goes wrong depletes health. So you want health to be at its optimal level. So we have to act before something goes wrong. And what do we call acting before something goes wrong? We call it being proactive. And so being proactive means rather than waiting until something goes wrong, we put measures in place to prevent them from going wrong in the first place. For example, if you're driving your car, you could drive around with um, a 5 gallon um, bucket in your car, or gas container in the trunk of your car, and drive your car until your car runs out of gas. And then after your car runs out of gas, you can stop by the roadside or wherever it is that it runs out and fill up that gas tank with the gas that you have in your car, in the trunk of your car, and then you go on your way. The problem with that is that, what if the place where you break down is a very dangerous part of town? We can't simply wait until something goes wrong before we act. We have to take steps and put measures in place to prevent them from going wrong in the first place. And so what do? We look at the needle of the car and see whenever the needle is going low, we make sure that we top up the gas to prevent the car from ever running out of gas. This is what being proactive is. And it doesn't mean that the car will never run out of gas, but it certainly reduces the likelihood of it ever running out. And so you put measures in place. You top up the tank before you go too low, so that you never run out of gas and you never end up in a bad part of town without gas in your car. All right? So that's what proactive means. So in reactive healthcare, and I know a lot of people think that when you have you do your executive profile, and a lot of people are, executive profiles are very popular these days. And a lot of people believe that when they do their executive profile, it means that they're being proactive. When you do lab work, or you're doing x-rays, or you're doing ultrasounds, or you're doing mammograms, or any other diagnostic test, there is no diagnostic test that is being proactive. Every diagnostic test is reactive, because no diagnostic test will be positive until something has already gone wrong. You get what I'm saying? So it doesn't tell you before anything goes wrong. It tells you after something has already started to go wrong. We call this early detection, which is earlier along the stage of being preventative, or earlier in the reactive stage, but it's not purely being proactive. So if you want to be proactive, you have to have an idea of what could go wrong, and then what things you need to do to prevent them from ever going wrong in the first place. Now, just like running out of gas, you can't have 100% control over running out of gas, because what if you're driving somewhere and your car is running low, but there's no gas station anywhere nearby? You may end up running out of gas. All right? So the goal though of our measures is that it reduces the likelihood of going into problems. And so by making steps, and a good example of steps that one can make is what we do with our lifestyle or eating. What do you eat? Are you eating a diet that is heavy in processed foods? Are you eating a diet that is rich in sugars and animal products? Or are you eating a diet that is rich in vegetable produce, whole foods, foods from the earth, that kind of a thing? Because depending on what choices you make as far as what you eat can determine how well your body behaves or responds. In fact, there are two things that will cause a disease to occur. Every disease is caused by two things, one of two things, or both things happening. But every single disease or illness is caused by two things. Either A, the body is not getting something that it needs to get. That is, the body has a deficiency. That's the first option. Or B, the body is getting something in it that it should not be getting. Something is coming in that should not be going into your body. That's called a toxicity. So you either have a deficiency, not getting something into your body that it needs, or a toxicity, something that should not be in your body that you are allowing into your body. Every disease is caused by one of those two things. So we have to make a choice. If we want to prevent disease, then we have to prevent those two things and those two things only. And that's where being proactive comes in. We take steps to prevent ourselves from ever going into depletion. So deficiencies like nutritional deficiencies, vitamin deficiencies, and so on. You try to prevent them by making sure that you have adequate amounts. And you get adequate amounts from your diet. And two, you prevent yourself from ever ingesting anything that is toxic to your body. If you ever knew how they make a hot dog, you will probably never eat another hot dog again for as long as you live. Or sausage. Sometimes ignorance is bliss, right? And so this is the situation. We have to avoid things that will make us unwell by toxicity, or avoid things that will cause a depletion by way of deficiencies. Those two things, if you do them, you do not break down, you do not get sick. We are in a crisis in this world, and the crisis is because we are trying to solve a lifestyle problem with drugs and surgery. Even with this COVID thing, we're trying to hide from something that cannot be hidden from. And in the process, creating damaging consequences. And certainly, it is, I guess, far better to shut down society than to let people die unnecessarily. But are those the only options? The answer is no, clearly not. It's not where, and I'm gonna pick on COVID here for a second because I want people to understand the fallacy in the arguments that people use. They try to say that we do these shutdown measures because we want to save lives. But it's a very expensive way to save lives. There are less expensive ways to save lives in this COVID epidemic. Because what we are told is that if we go out and we interact with others, we have a chance of sharing the disease with other people. Bearing in mind that 99.7%, 7 some percent of anyone who gets COVID will not die from it. That's the first thing to bear in mind. Having been around for over a year now, we have a very good idea of those people who are at greatest risk of death by contracting COVID. So just like we do for every other disease, the persons who are either ill or vulnerable, these are the people you isolate. Whenever you start isolating healthy people, you are messing up the fabric of society. Because if you isolate healthy people, or you quarantine healthy people, or you lock down healthy people, tell them to stay home, don't go anywhere, what have you, then everything that is a part of society will start to break down. I mean, who is going to be able to take care of the kids? Who is teaching half of these kids? Most parents don't have the wherewithal to teach their kids what they need to know in school. So you're destroying the education fabric for the children because you want to prevent deaths. Well, there are better ways to preventing death. If I know that my grandmother is somebody who is susceptible to death, then I do whatever I can to protect her. One way that I can protect her is making sure that I keep my job, because I have to have money to pay for her medications or pay for whatever else that she might need to stay healthy. You get what I'm saying? So it's not about opening up society or and let people die, or close down society to save lives. You make wiser choices in terms of how you shut down and how you lock down. So I am all in favor, as the Bible will tell you, it is the sick people that you quarantine. Somebody who has leprosy, the Bible says that they will walk around the place, and if they come across anybody that comes near them, they will shout out, unclean, 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 so that everybody will know that they're unclean, and stay away from them. They are going to be in isolation. Not everybody else in isolation, the sick person in isolation. So if it is a matter of being afraid of contracting this illness because you are in the vulnerable group, then it might be a good idea for you not to venture out too much. Just as an example, right? But it's a very bad idea to tell everybody else to shut down and shut away. And if you live with somebody, because not everybody lives with somebody who is in the vulnerable population. But if you do live with somebody in the vulnerable population and you have to interact with that person, then when you're interacting with that person, you might want to social distance when you get home for the sake of that individual. Or you may want to make sure that you shower and everything is organized and you sanitize or whatever before you interact with them. There are better ways of doing things. And I just think that, this is just too costly an approach. There's a question from one of our participants. Says, where do cancers fall? Deficiency or toxicity? The answer is both. If you are exposed to something that is toxic, you may develop a cancer. Or if you have certain nutritional deficiencies, you may develop a cancer. For example, an easy way to look at it is like somebody with AIDS. If somebody has their immune system is completely shut down, for example, then they are not able to fight cancer cells that develop in their bodies. And so that is a deficiency that's causing them not to be able to fight the cancers, and so cancers proliferate. Or if you're exposed to chemicals from a factory, there are some heavy metals that run off from factories or that end up in our water supply that are very toxic to our bodies, and that can cause damage that can end up with cancer. So cancers fall under both categories, as a result of deficiencies as well as a result of a toxicity. Hopefully that helps. All right. So if I want us to change, if my desire is to change the way we think about things in life, then the starting point, if we want to change our behavior, rather, if my goal is to change our behavior, the starting point has to be change the way you think about life or the way you view life. You change your worldview, you automatically will change your behavior. 100%. You can't think differently and act the same way. I know a lot of people, they have kids who don't want to do their homework, and so they tell the kids, do your homework, do your homework, do your homework. Kid doesn't do their homework. Then you take the child downtown and you show them some persons who are, you know, scrounging around for food because they did not complete school and they are not in a position to earn for themselves, and so they're in a desperate situation, and so that's what they're doing. They're suffering on the road. This is a reality for some people, and it's not a judgment statement. At least I don't have a judgment heart when I'm saying this. And so if you show your child that scenario, then they may have a very different appreciation for the value of homework. And in doing that, they may now have a different outlook on life. And once they have a different outlook on life, their behavior will change. And that's how it is. So if we want to change the way we behave, we have to adjust the way we think. And there are two ways that people think in this dispensation, if you will, that I want persons to kind of pay attention to, right? You can think in terms of the illness care model, and then you can think in terms of the wellness care model. The illness care model and then the wellness care model. If you look at the illness care model, you ask yourself the question, who teaches us to think this way? The illness care model is the way that most of us will think. I won't say naturally, because we're actually taught to think this way. And we learn to think this way from ads we hear on TV, ads we read in newspapers, apps that pop up, ads that pop up when we're watching a video or whatever. These are ads from the pharmaceutical industry. They teach us that if we have a headache, we must ask what we can take for the headache. Or if we have blemishes on our skin, we ask what can we take to ease the blemish on our skin. So the immediate thing is, whenever we have a problem, the question is, what do I need to do or take in order to feel better? That is how we think. What do I need to do or take in order to feel better? And that is limiting. A better way of thinking is, what do I need to do in order to get better? If you ask yourself that question, then you will have a much better chance of achieving optimal health or returning to optimal health. What do I need to do in order to get better? Another way of thinking is the get well soon mentality. I don't know if you've ever done this before. Have you ever gone to a hospital to visit somebody who is sick, and you bring a card for them that says get well soon? That card that says get well soon, it's a wish. That's all it is. You're hoping and wishing that they will be restored to good health. You're not saying to them, get up and walk an hour, or start eating some vegetables and fruits and what have you, and eventually you will return to good health. No. You are hoping and wishing that they will achieve good health or attain good health without achieving good health or without working for good health. You want them to good health to just drop in their laps. Well, that way of thinking is wishful thinking, and it offers no real value to the person that you're conferring it to, other than it sounds nice and it feels good. If you want people to achieve or to have a better chance at wellness, then you have to realize that wellness is not about the destination, getting to wellness. It is about the journey, the process toward wellness. So instead of saying, what do I need to do in order to get well, you ask, how consistently must I work in order to stay well? Because wellness is a journey that you stay on. And as soon as you stop working toward wellness, you start moving toward illness. And that is the reality that many people don't understand. Wellness is not, I know a lot of people ask me, they say, well, doc, I'm starting to feel better. How long do I have to keep coming to a chiropractor to adjust my spine? After I'm better, can I stop now? Or, doc, I no longer have any pain, so should I stop my treatments now? And I always ask a very simple question that most people can wrap their minds around, and it's this. How long should you service your car for? Because when you, if you, especially if you have a new car and you service the car really should not have any problems. So why do you service it in the first place? Clearly, it's not because something is wrong with the car, but precisely because you don't want anything to go wrong with the car. How much more our bodies? Too many times we allow our bodies to break down, and then after we allow it to break down, then we try to do something to patch it up. That is the reactive model, and this is the model we're trying to break away from. What I would rather people do is to periodically do things to improve their health. One of those things that we can do periodically is the chiropractic adjustment, because it's one of the best things that we can do mechanically for our spine to improve the health of our spine. You improve the health of your spine since the nerves control the functions of the body and it travels through the spine. Then the spine has a chance of aiding your body to remain well. Certainly, it's not the only thing, it's one of many things. But you have to do things in anticipation of to prevent them from going wrong in the first place. The last thing is staying alive. There are people who view how well the system is doing, the health industry is doing, by how long people live. Now, they look at life expectancy, right? And they say life expectancy in the early 1900s was 50 something years, which is true. In the early 1900s, life expectancy was about 52 years in the US, in the urban regions. And I say the urban regions because rural places had very different outcomes. But in the urban regions. But today, life expectancy is in the low 80s, high 70s. Even in Jamaica, it's the high 70s for life expectancy. So let me show you that how long somebody lives is not the most well, how old you can get a person to live to, like people in old age. If you can increase the number of old people that you have in your community, it doesn't change life expectancy numbers very much. Because say for example, you put in measures that can get somebody, instead of dying at 75, they live to be 80. Then what you have done is added 5 years of life to those people. But what if half of the, because people die for different reasons, right? Some people die in car accidents, some people die in childbirth, some people die at birth. What if you had 20% of newborns only making it to 5 years of age? Only 20% making it to 5 years of age, which was closer to the truth back in the 1900s. And instead of those 20% making it to a good old age, they make it to 5 years. When you look at the numbers now, you're averaging those people who live to be 5 with those people who live to be 80, and averaging all their ages, you come up with 50 something or 40 something. What if you increase the cleanliness in the hospital, the surroundings, the situation surrounding the mothers, so that a child doesn't die so young anymore, and that child can now achieve adulthood? Then that child will move from dying at 5 to now dying at 20 or dying at 30 or living to be 50 or 60. We're talking about adding decades of life to an individual if you can stop them from dying in childhood. And this is exactly what happened. Life expectancy numbers are highest for places where children, the death rate among infants is the lowest. Should make sense, because then you're adding decades of life to the average, and so the average will go up much more than if you say try to add 5 more years to the life of an old person at the end of their lives. So staying alive is not the most important thing. You know what's more important than staying alive? Is feeling alive. Having that quality of life where you're able to do all the things that you would have once been able to do or once were able to do that you are no longer able to do because of age, you can still do those things. That is good quality of life. And that's what I want. I don't want to live long if I can't have a good life. What sense does it make occupying space where everybody has to take care of you? I don't want that. Do you want that? Do you want to be 100 years old in a hospice setting where you have round the clock nurses bathing you, um, cleaning up after you, feeding you because you can't do it yourself? That's not what I want. Maybe some people might want that, but I certainly don't want that. And so feeling alive is way more important, in my opinion. And so when we look into it, the whole issue of changing your mindset is moving from feeling better, getting well, staying alive, and watch the subtle shift now to getting better, staying well, and feeling alive. Those three things, very different things, but it's a subtle change to achieve them. Instead of feel, get, stay, it is get, stay, feel. That's it. You do this, you will achieve a better outcome in life more times than not. And even if you still get sick, even if you still have a disease, even if you die, the quality of your life is more likely to be better. I look at the quality of my life, right? And there are many things that impacted the quality of my life. No, I was an athlete at an elite level. And as a result of that, I trained my body extremely, extremely hard. And I have consequences to that kind of a push that I did over several years. I have consequences to my joints. I have consequences to my some of my muscles with scar tissue and what have you, because I pushed myself really hard. However, I ate a particular way because I was disciplined, and I continued some of those very good habits and probably even have improved on some of that now. And what I found to happen now is when I look at myself now, right now I'm 176 pounds. When I was competing at about 161, 163 pounds. So I am within 15 pounds of my competition weight when I was an athlete. Most of my friends as athletes are considerably heavier than they were when they were athletes. As a matter of fact, I have a few of them who are morbidly obese. And this comes with a set of complications, the diabetes, the high cholesterol, the hypertension, and these things. I have none of those things. And I have none of those things because of my nutritional lifestyle, my mindset, my exercise levels, all of these things. It's not because I'm lucky. It's not because I'm born to a good family with good genes. It's because I made choices early in life so that I don't have these things. And so I want people to realize that the quality of life that you live is dependent on you. You are the one that's responsible for your health. You are the one. I'm not responsible for anybody else's health but my own, or anybody that I have to make decisions for. But my patients, no. I am not responsible for my patients' health. I'm responsible to help take care of their spines. I might give them advice about health, but I am not responsible for their health. At the end of the day, you are responsible for your own health and well-being. Now, the rest of this moves by quickly. I know it's 7 keys. We're just now entering the second key, but the rest of this moves by quickly. So the second key is the truth about pain, and that the question that we ask in this one is pain a good thing or a bad thing? Is pain a good thing or a bad thing? There are people who believe that it's good, some people that believe it's bad, but there's something that we all can agree on, and that is that there's a purpose to pain. And the purpose to pain is that pain alerts us that something has changed and requires our attention. Pain alerts us that something has changed and requires our attention. And now that is important. But there's a limitation to pain. Pain has limitations and hence pain has problems. Because of the limitations of pain, you can't trust pain to always tell you when something has gone wrong. In fact, there are many times that something has gone wrong and pain doesn't even warn you that something is wrong. There are some people with cancer, and while they have cancer, there is nothing to let them know that they have any cancer. There's no pain to warn them until it gets to an advanced stage. And if you didn't know that that is true, think about the last time you heard somebody find out that they had breast cancer. How did they find out they had breast cancer? They either did some test, or they did a breast self-exam, or while they were showering, they felt their breast and felt a lump. And the lump is usually painless. They're dying with cancer, but their lump is painless. This is how it starts. All right? This is how it starts. So the idea behind it is you can't simply trust pain to tell you whether everything is right. In other words, you can't trust how you feel to know if you're doing well. So pain cannot be trusted. Good health doesn't equate to feeling good. There are many people who entered a 5K, running a 5K, and then falling over dead from a heart attack. I know people who are working out, and while working out, and they are fit people, they have a heart issue and they fall over and die. You can have great fitness but poor health. Fitness and health are not equal to each other either. So that's important for you to point out, for me to point out. If you want to know if you're having good health, the function of your body must be good, and that's what you need to focus on. Focus on how well your body is functioning, not how well it feels. So we need to start learning how to trust function, not feeling. Trust function, not feeling. That's what it's about. And so when we look into this whole issue of functions of our body, we trust the functions because we have to assess the different systems of our body. This is how we know if the function is good, if the systems are working properly. And the different systems of the body include the following: the immune system, the digestive system, cardiovascular, integumentary system, which is the skin and coverings, the respiratory system, the endocrine system, reproductive system, excretory, musculoskeletal, and the nervous system. These are the different systems of the body, and if all the systems of the body are working properly, then the whole body will work properly. If any system is not working properly, then the body cannot be considered to be healthy. Can you say your body is healthy if your cardiovascular system is not working properly? No. What if you have a problem with your reproductive system? Are you healthy? No. Digestive system? No. Every system must be working properly in order for us to determine that we have good health. Now, of all the systems of the body, the nervous system, and let me repeat, the nervous system is the system that is considered to be the master control system of the body. The nervous system is the master control system of the body. What does that mean? It's the master control system of the body. I don't know if you've ever built a house, but if you've ever built a house, you will know that you have different components of a house. You have the masonry work, You have the carpentry work that needs to be done. You have the plumbing that needs to be done. You have the electricals. These are all different things, elements of the house that need to be done. But when you look at the electrical system of the house, there is the circuit breaker box that is used to control all the electrical elements within the entire edifice. And so if you have a refrigerator, you can control whether or not that refrigerator will work or not work depending on what you do with that circuit breaker box. Because you can flip a switch and turn off power to the refrigerator, and then all the meat in the fridge will spoil. The body is designed in a very similar way. In fact, the way that we design buildings and objects oftentimes came from the body as the template. So when we look at the spine behaves like the circuit breaker box. So let me try to see if I can zoom in a little bit closer here. For you, and you can see that each of the organs have a nerve that goes back to the spine and ultimately up to the brain. The brain is the master organ of the nervous system. From the brain, you have the spinal cord, which runs down through the middle. And then from the spinal cord, you have the nerves that exit to go to the different organs and glands and tissues of the body. Now, when we look at that, if you notice, the heart and lungs both have a nerve supply. The digestive system has a nerve supply because it's our brain that governs how everything will work. Now, very importantly, all these nerves have to travel through the spine, and if you have a problem with your spine, it can impact the function of one of these organs. There are persons who have a whiplash accident, and immediately following that whiplash accident, they end up with rapid heartbeat or tachycardia or heart palpitations. Or there are persons who end up with an accident like a fall, and after the fall they start to develop sinusitis, or they start to develop asthma or allergies where they did not have it before. And so the question is, how is it that these things can happen to somebody when they never have had it happen before as a result of an accident? And that is because the nerves that leave the spine control the functions of the body, and they can end up with problems if you don't do what you ought to do. I'm going to try to make sure that we get finished by 7:30 here, okay? And so this is important. We call a misalignment in the spine a vertebral, for spine, vertebral subluxation. That word subluxation means a bone that's out of its proper orientation relative to the other bones that causes interference to the nerves that have to exit between them. It's a simple thing. In fact, sometimes you can even feel a subluxation before you can see a subluxation. I don't know if you've ever had a pimple on your face and you look in the mirror and you don't see a pimple, and then you rub your finger over your skin and you can feel the pimple on your skin, but when you look, you don't see the pimple. That's because our sense of touch can oftentimes be better than our sense of sight. And that's a truth. Alright? So you can have a bone that's displaced out of its normal alignment, and the opening where the nerve exits gets closed off because the bone is out of its alignment to the other bones and causes a pinching on the nerve or the irritation to that nerve, and therefore anything that that nerve controls, it will impair its function. If that nerve goes to your digestive system, for example, your esophagus for swallowing, then you may end up with GERD or acid reflux. Acid reflux is not a stomach problem usually. The vast majority of times that somebody has acid reflux is because their esophagus is not working the way it should. The esophagus is under the control of nerves, and if these nerves are not working properly, your esophagus won't close fully, and so the acidic contents of the stomach may spill over into the esophagus and cause the burning. So you have to understand that the nerves control the functions of the body. Stress is what interferes with nerve function. And there are three general classes of stress, and they are physical, biochemical, and psychological. These are the different ways that stress will impact us, and they each can have profound impacts on how our bodies respond. The healthier our nervous system is, the better we are able to adapt to our environment and to our stresses. And so this is important for us. This slide we call the general adaptive potential, explains why people get sick. And to explain it, I'm going to use an analogy called the gap analogy. Now, in the gap analogy, it's saying we're using a gap to explain this general adaptive potential is our ability to adapt to our environments. And just like every gap has a lower limit, a gap will also have an upper limit, where the space between it represents the gap. The wider the gap, the better you are. The narrower the gap, the sicker you are. If the upper limit goes up further, you're approaching vitality. And if the upper limit comes down so that the gap is getting narrower, you're approaching death. It is our external stresses that oppose our upper limit and causes it to come down. So if we are making bad choices, we are exposing ourselves to toxins all over the place. We are causing our stresses to bombard our systems and causing our system to start to become more vulnerable by narrowing our gap. But if our resistance is good, we're getting all the nutrients that we're supposed to get, we don't have any deficiencies, then we're able to oppose the effect of stressors in our lives and we get healthier. And as long as all the experiences in our lives exist between the boundaries of our gap, we do not break down, we do not get sick, we do not falter. It is only when our upper limit now falls below a level of our expectance or our experiences where we are now susceptible or vulnerable to whatever this issue is. Now, for some people, they are most vulnerable because of diabetes in their family. And not because you have diabetes in your family means that you must have diabetes, but if you live a similar lifestyle to those in your family that has diabetes, you will develop diabetes too. Or heart disease, or cancer, or whatever that ailment is. So watch carefully, please, because if you allow your upper limit to fall down, then it may now, these two areas may now exceed your ability to adapt. And then you get sick. So I hope this makes sense because our ability to adapt, and I'm going to just kind of quickly share this one, is that our ability to adapt is determined by the width of our gap, our general adaptive potential. And we want to make sure that we're adapting well. All right? Chiropractic, the healthier our nervous system is the better we can adapt to our environment. So chiropractic is one of those tools that can help to widen our gap. Chiropractic can add to our internal resistance. But chiropractic alone doesn't solve the problems of life. You need to ensure that you're doing everything in your power to improve your overall outcomes. Otherwise, you're going to be in trouble. Chiropractic alone won't save you. Key 6 is identifying subluxations. I mean, remember, subluxations are misalignments wherever and whenever they happen. And at our office, we have invested in technology that help us to do this. We have technology that is certified by the Space Foundation. One is a rolling thermal scanner, which measures the skin temperature. And the other one is a surface electromyography unit, surface EMG, which measures muscle activity in the spine. These are two of the things that we use to help us to achieve that. It helps us to tell us where something is wrong and where it needs our attention. Now, there's a question as to what kind of a doctor is a chiropractor. And to know this, we have to understand how chiropractic really helps. And does chiropractic really improve the function of the nervous system? Well, if it does, then there has to be a way of demonstrating that it improves the function of the brain itself. And this study actually is one very nice study that shows that. So a lady was asked to wiggle her left ankle, and they took a picture of her brain using a special unit called a functional MRI unit. The functional MRI shows areas of activity in the brain as areas of light. Areas of activity in the brain as areas of light. And so what you see is before the adjustment, when she was asked to wiggle her ankle, her left ankle, you had light all over the brain. After the adjustment, you only had light in a very specific area, which says to us that after the adjustment, it took less brain activity to do the same task, which means the brain got more efficient. This is very important. This is very important. And not only that, but the part of the brain that lit up was the right-hand side of the brain, which corresponds to the side that we would expect to see action corresponding to a left side of the body function. So the question that I asked is, what kind of a doctor is a chiropractor? And the answer is that a chiropractor is not a bone doctor. A chiropractor is a nervous system doctor. And that's because the work that we do impacts the nervous system more than anything else. I'm also a chiropractic neurologist. Every chiropractor is trained to realign the spine. Every chiropractor is trained to realign the spine. But as a chiropractic neurologist, my schooling includes retraining the brain itself. And so there are special treatments or exercises that we can do to stimulate brain function to improve different parts of the brain that might not be working properly. These are some of the examples of things that I have personally worked with, and so I share this with you so that you can have an idea of just the breadth of things that can be treated without medication or surgery. Now, not everything here I'm saying can be fixed back to normal, but everything here can be improved to some degree. So at Gardner Chiropractic, we have a vision here, which is to identify subluxations wherever they happen, to provide a program of chiropractic care. And for our office, that program might be a 12-visit plan. All right? And then we do an update exam. I like doing an examination every so often because it helps us to make sure that we are on track rather than working indefinitely and not knowing where we are. And then we also educate our community by doing classes like this, or I have a Facebook show that we have called Back to Health. If you go to Facebook and type in Back to Health Talk Show, that's Back to Health Talk Show on a Tuesday night at 8 o'clock Jamaica time is when that show airs. You can actually join us online, live, and watch that show. It is done on Radio Jamaica 94 FM here in Jamaica, and it's a very useful tool. So join us there. Who's responsible for our health and well-being? The key to success in getting and staying well is for us to take responsibility for our own health and well-being. It's for you to take responsibility for your own health and well-being. No one else is responsible for your health except you. And you are also responsible for your children's health because you are the caregiver. But you might also be responsible for the health of your aging parents. And so if you belong to my generation, which is called the gap generation, we are responsible for our children as well as for our parents in some regard. And so we want to make sure that we inform ourselves adequately so that we can make wise choices. And I hope you understand that this is not about chiropractic alone. Chiropractic is just a small part of it. This is a whole lifestyle approach. We have testimonials that are on our YouTube page, our YouTube channel. So those of you who have not yet subscribed, I'm going to ask that you subscribe to our YouTube channel by clicking on the subscribe button and clicking the notification bell so that once we go live with a video, it will show up in your feed. Every 5th Thursday, I'm planning on doing a video, sharing a video with my my patient population or those who are following the page, the channel, so that we can discuss it and look at ways that we can improve our health. All right. So stay tuned for that. I think the next fifth Thursday in the month, I think is May. Not 100%, but I think it's May. Why not check now? It's actually April. April 29th is the 5th Thursday in April. And so next month, I'm going to be showing a class. I'm going to be showing a class that you can participate, a video, sorry, that you can watch, and then we can discuss it afterwards. Because the goal is to help you to understand things. And this might be a show on, I don't know, maybe it's on the pharmaceutical industry. Maybe it's a show on autism. Maybe it's a show on vaccines. I'm not sure yet what I'm going to be discussing with you. There are many shows that I've seen and I like that we can share and then discuss. So let's see how that works out. The question, is there a subscription fee? The answer is no. You just, right now, you can just go to, look at the bottom of the page where you see the video and look for where it says subscribe next to my name, and just click on the subscribe button, and then it will give you the option to click on a bell icon. This bell icon has nothing to do with JLP or PNP. This bell icon is just a notification icon so that they can notify you if we go live with a video. All right? For those of you who are just who are not currently patients of ours, here's a special offer. The offer that we have for you is that if you are not a current patient and you would like to be examined, and well, as far as in answering your question, Blossom, you know, I don't know what YouTube will do with the information because it's a private company, but we don't share anybody's information with anything, nor will we be able to share it. What it primarily does when you click on the subscribe button is that anywhere that you subscribe, anyone that you subscribe to, you're basically saying that you're interested in videos that they post, so that if they're posting a video, it's easier for you to find it in Facebook. All right, and Facebook also, sorry, on YouTube. And YouTube will also either send you an email notification, or if you open YouTube, you will see a video. If there's a video from somewhere that you've subscribed to, it will show up in your feed so that you can see that they're live. So that's really what that is about. Um, so, but you have your choice as to whether you want to do that, yes or no. If you're not a patient of ours and you'd like to come in for an examination, as a very special offer for those who have sat through this class, we're giving a 40% discount. Yes, Blossom. We give a 40% discount um, for anyone who might want to take advantage of this special offer. Now, this 40% discount is a pretty big discount, but it only applies to those who are not currently patients of ours, or meaning that you have not yet come in for your new patient exam. Even if you have already made an appointment but have not yet come in for your exam, this still can apply to you. But for those who are existing patients, you actually will get more than just that, because you will get a 20% discount off your update exam. That's provided that you didn't already receive the new patient exam discount. But you'll get a 20% discount off your update exam, a 20% discount off one treatment per person that you refer. We call this our referral discount. So if you refer somebody to the office, then you'll get a 20% discount off one treatment. If you refer 2 people to the office, then you'll get 20% discount off 2 treatments, or 20% discounts off 1 treatment. So you can get a 40% discount off 1 treatment, or a 20% discount off 2 treatments. It's the same overall, money that you're saving. But this is what we do. And lastly, we put people on a phase of care. Like I said before, it's usually 12 visits. So if you're already an existing patient, you'll get a 10% discount off your entire next phase of care if more treatment is required. And this is automatic. All you have to do is make sure that your name is listed in the chat section. And just to be on the safe side, you can send an email to appointments@gcnjamaica.com. That's appointments@gcnjamaica.com. And that will really help you to make the most of this opportunity, right? So if you are interested, make sure your name is listed in the chat section so we know that you participated. And send an email to appointments@gcnjamaica.com, and your name will be added to that list of persons in the existing patient list to get that discount. Or somebody will contact you. If you're a new patient, make sure that we have your contact information in the email so that somebody can contact you and arrange your appointment for you to get that 40% discount. I hope it was very helpful being here tonight. Went a little bit over, but there are different ways that you can interact with our office. One way is by simply going to our website at gcnjamaica.com. That's gcnjamaica.com. Or you can go to our Facebook page for the practice at GCN Jamaica, or on YouTube by just typing in the search section Gardner Chiropractic. Or if you're interested in following our show on Radio Jamaica 94 FM, you can just go to Facebook and search for Back to Health Talk Show. Like the page, become a follower of the page, and whenever we go live, it's every Tuesday night at 8 p.m. Jamaica time. So I hope this information was useful for you, and I hope you get a lot out of it. I pray that God will bless you and keep you, And thank you so much for all that you have done in participating, in interacting. I'll try to stay on for a couple minutes and ensure that you, if you have any questions, that I'll answer them for you. So I'll stay on for a couple minutes to answer any questions that you may have. May God bless and keep you, and I look forward to interacting with you at some later stage. So have a wonderful night, and God bless. Take care.
Here we go again. Trying hard, but you wanna be my friend. Ain't no place to hide, ain't no one to run to. Here we go again. Call my bluff, I'ma be here till the end. I'm the one you ride, I'm the one you ride to. If you don't wanna change, ain't no place to hide, ain't no one to run to. If you don't wanna change, I can help you out, 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 I can help you out. Here we go again. Time is up and I'm calling up my friends. Ain't no wonder why, ain't no one to ride to. Here we go again. Call me up